ready?
Okay, 5, 4, 3, 2.
Good afternoon, everybody. This is Refilo and your girl Tandegam Tetwa from K.I.P. Echo. We are here to raise. Well, what? Why can't you take over? Yes, as you were saying, my lady. What are we here for?
We are here to basically promote and raise an awareness for breast cancer. As it is October, the last day of October, we're just going to be sharing a few perspectives. We're going to be speaking to one of our experts that knows more about breast cancer. And we're going to be sharing some personal views on what breast cancer is to us and what we've experienced as Abantu Clubbing. So yeah.
As you can see, as we are glowy, glamorous, and all pink, that is, we are actually representing women that actually went through breast cancer. But yes, because it's breast cancer month, we can say breast cancer, but eventually we could also say every woman or every person that has gone through cancer, cancer treatment and cancer whatnot. You can name them cancer treatment. Some were even late, they discovered it in stage 4, but as she said, we do have an expert that we're going to be shortly interviewing online, so we're just going to be telephonical interview, so stay tuned.
Can I add on?
Yes.
Pink is basically a color of utando. Today is Friday. Friday is usually like a pink day. Abantu abazi more about astrology, but I'm not going to get into that. But another fun fact with breast cancer is not only for women, it's not only affected by some men do also experience breast cancer, but it's something that we can also dive in and research. But what I've heard with breast cancer also affects men as well, so it's not particularly for females. So yeah, it's basically for Ongomundu that is affected. So we're just going to go on to the next part of the session where we speak about how breast cancer has affected us personally, and my own experiences about breast cancer. Cancer is what
Cancer as a whole,
yeah,
I can't have a specific explanation of what cancer is, but maybe I might have a glimpse of what cancer is and perhaps how a patient or perhaps a person that has cancer looks like. What are the signs, right? Some they do have a fatigue, loss of weight, but I'm not saying when you are losing weight you do have cancer, but eventually you can go for a checkup to check if you don't have cancer, which is very important and the reason why we are today. So I've seen somebody who had cancer, but not specifically breast cancer. I know. So yeah, it's just a traumatic situation to see. It's a wound that looks that doesn't look nice, but yeah. And we also honor the legend that actually survived cancer. I really give them a heads up because not everybody can survive this. But it's Zulu. Yes.
But yeah, breast cancer, guys, it's very well. Cancer as a whole is something that's very hard to deal with. Apparently, it's very sore, and abantu that go through the whole treatment or the whole phase of it. It's the hardest thing on earth. I don't know what's my competition, but it's very painful apparently. Breast cancer, guys, what I would say, it's a virus. Obviously, it's a virus or a disease that you cannot cure, and it's one of the hardest diseases that people have been trying to cure for years. And I told ukuthi isuka kanjani and how you can actually cure it. Personal experience, I was very young. I was, I think, 11 or 10 when she had breast cancer. She was old. I think she was 70 something. And very I'm cool, so I'm guessing ukuthi vele as obesity or it also affects ukuthi ungayithola breast cancer. There's certain symptoms that you get or certain causes that affect amathuba akho ukuthi uthole breast cancer. So njengoba yena wayesemdala emkhulu, I'm guessing ukuthi the fact that amafutha esemaningi emzimbeni. They couldn't fight off the cancer, the arteries and whatnot. So wagula ugogo for like the longest time. Esegula wenza chemotherapy yamenzani. She lost hair. Ngambona ugogo ethi gula. She had sores like when they londa. And I'm like, what is this? Like I was very young and I'm like, what is this? But being a smart girl, I started researching. I was like, where's the galani? So at some point I would see her in zakhe siphuma. Ethi uyaqama ugogo ziyayiphumela nje abuya ithi ikhanda ziyiphumela ziqasa iphansi. I'm like, oh shit, this is cancer.
It's traumatic.
Yeah, part of my language, but ziphumile zakhe. I was like, okay. But for me it wasn't so traumatic because always in dark crazy on TV. Is the first escorting my boy best journey house.
You watch a lot of horror, that's a problem.
No, I think I was very geeky at that time because I would watch the shows that I would order and I would see okay, what's on. So with her, I noticed the phases that she went through. From a camereni to the dining room or wherever she was gonna go, for chemo treatment. So they would go out, ngathi yabo banja ngapha abantu babili bamhambise passage hamba yongena emotweni hamba baye esibhedlela abuye futhi ezindlini. So throughout insuku zakhe zokugcina, she was like, no, I don't wanna spend my time esibhedlela, I wanna go back to ekhaya. Yasekhaya bamngenisa lapho sihamba nge-wheelchair naye manje ikhona ngoba sekubuhlungu ukuhamba.
But it's funny how they can the practitioners, they can actually guess the minimum period of time that the person who's diagnosed with cancer, the time that they have left with to live, which is kind of traumatic. I wonder how do they actually find or probably notice what's in a. So this Orefilo is gonna live for like 3 weeks before she dies.
They probably can test the actual cell, the cancer cell, by more okay, Shabesi for this type of age and Shabesi said this but we can probably ask the experts because there is a certain way check how long you have to live. Abanye they leso sikhathi lababekele sona bayakwazi usibadlula. So no, but I was gonna live for 3 months. Then they beat the 3 months because why? They had like they had a certain diet that they had, or they started exercising, they started following a certain ritual or a certain something that they needed to do for them to get better. And then in that way they prolonged the period of bapi. But yeah, but cancer, it's not a joke. It's one of the most serious diseases and you die, bruh, like sorry, but like it's sad.
I understand.
Because once you see every phase of a woman dying slowly by slowly, and it's horrible. But abantu abaningi futhi abazi and they think ukuthi isifo sabelungu nanokuthi futhi it's hereditary.
Hereditary. It is really questionable. But now coming to that, when was it's just a question that doesn't need actually an answer, because right now would have to go back and dig more if we really want to dwell more into this cancer. But my question was, back in the days, back in our granny's days, I think I was not there, but I think given the years that most grannies have lived, or perhaps our parents, grandparents and whatnot, great-great-parents, I was raised by my great-great-mother, whom I thought she was my grandmother. Yes. So now I'm thinking, what were those people treating easy for bangazazi back in the days before the science came in? Well, those are the questions that we'll really have to go back and do more research about. So, but for now, guys, let's stay tuned. We're gonna come back. We're gonna take a very short break, and yes, that's K.I.P with you. Yeah, boy. I'm gonna smile up here now. How?
Okay, we're back again. Now we have a segment where we call one of our experts. We're gonna call him on the line now. Yeah.
Okay. No, nothing. I don't have anything to say. Let's just wait for expect to. Hi, Kaya. How are you? Hi, how are you? Good, thanks. So I'm here with Urifile. I'm good, thank you, Kaya. Hi, can you hear us? Hi, Kaya. But Kaya, hello? Yes, we can hear you, but you can hear us back. Yes, we can hear you. How are you? Lord have mercy. Oh, Lord. Yes, I can hear you. Can you hear us? Yes, I can hear you. Ndiyakuva wena we can actually hear each other. You can actually answer the questions at your spare time and then you can send them to me. It can either be via a video or voice. It's okay. And then uzasendela kum then into engizoyenza I will just sizodibanisa ama clips together. Thank you. Thank you very much for your time.
Morning, Ree. Sorry, waited to respond this late about these answers of your questions, but I'll answer them now. You asked about the symptoms of a cancer. Let me start by explaining what cancer is. It refers to any large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy in normal body tissue. You understand? So, in simple terms, it means that if it happens during the replication of cells in your body and one of the cells replicate okanye it multiplies okanye during that process of replication okanye during that process of division of cells, and then one of the cells does it abnormally, ne? After it has done it abnormally, it means that that cell it's going to replicate abnormal, meaning that that cell is not the same as other cells emzimbeni. So it's going to form a different tissue that has cells ezingafani nezinye that are in your body. So as it replicates, it becomes dangerous emzimbeni wakho and it causes cancer because now it's like a foreign object. It doesn't have similar cells than your body. You understand? And okay, coming to your questions, the signs and symptoms of a cancer. The signs and symptoms of a cancer, okay, they always vary depending on what part of the body is affected. Because there's a lung cancer, there's a brain cancer, there's a blood cancer that you get it in your blood. There's like different cancers in your body, and you will have different symptoms depending which part of your body is affected by this cancer. Okay. But the general signs and symptoms associated with cancer, they include fatigue, they include lumps or areas of thickening that can be felt under your skin. They include unintended loss of weight. Sometimes other people they gain lots and lots of weight. And then there might be skin changes such as yellowing, darkening of the skin, or redness of the skin. You might have sores that are not healing, a change of bowel and bladder movement, persistent cough or trouble in breathing, a difficulty in swallowing. Like there's a lot. It's general symptoms. But if we were to be specific of where exactly you are affected by cancer. I'm going to make an example of a lung cancer. If it happens that you have a lung cancer, you're going to have a different symptoms than when you have a brain cancer. With the lung cancer, you're going to experience some shortness of breath. You're going to experience some swelling of your feet. You're going to experience things that are associated with breathing. You understand? And you asked, where can one go when they are suspecting that they have a cancer? It's going to the health facilities because that's where you'll get a clarity if you have a cancer or not. They'll run some bloods and find out if you do have cancer, and if needs be, they will do some scans, your CAT scan, to check if you don't have if whatever you're having it's not cancerous. So you just go to a health facility um and get help there. They're going to tell you, the doctors or whoever is they can help you with that, um with actually determining whether what you're having is cancerous or not. The average percent of cancer generally at 6 out of 10, which is 60%. That is generally. And then if we then go into different parts of the body that the cancer has affected you, the statistics are saying that and under the breast cancer it's 84% survival, under the prostate cancer it's 82% survival, and then colon cancer it's 54% survival, and then lung cancer it's 13% survival. So it depends on which part of the body or on which organ you experiencing the attack of this cancer. Because you see, if you go to your lung cancer, it's very, very low survival, because I mean, like, that is one of the crucial or very important part of the body. Uh, so that's why it's lower than the others. Otherwise, yeah, it's like that. Hey, beside chemotherapy, the radiation, the eating well, and the exercising, I don't think there is a better way of fighting a cancer, especially with herbs. I'm not sure. I don't have any evidence that the herbs don't work, but in a health perspective way, on my side, I don't think herbs can help cancer. Cancer needs chemo. Cancer needs irradiation, so to kill those cancerous cells, so to take away that tumor that is growing, that is cancerous. You need your radiation, you need your chemotherapy, and also you need sometimes a surgery to remove the the cancer the cancer cell not cancer cells, the cancer tissues, cancerous tissue that are caused by a cancer.
Everybody, as you can see, we had technical problems. The network wasn't connecting. So, however, we tried to get everything that we needed. So, it'll just so Hlangana corner, you see everything in the video. We couldn't interact since we couldn't interact with him. So we'll just see what we can do. Technology, yes, technology. But now coming to my questions, my question when I said, now I wonder what our great parents and great parents were actually using to cure diseases that they didn't understand, and perhaps they didn't have an actual word for them, because now everything it has got a specific word that is used to describe it, right? Like cancer, HIV, and everything. Back in the days, I doubt we had those because our people didn't have knowledge under that. So I think my co-host here can maybe brief us maybe on what can actually be done.
But my thing is, did we even have those diseases like such cats? Because now it kind of seems as if those diseases came through now due to how we live, due to how our lifestyles have kind of changed over the years. I would also blame it. I don't want to say blame it, but I also want to say ukudla has a huge impact on how our bodies react and how our bodies have possibly adapted to ama-diseases kade ukuthi aqhamuka kanjani angazi ukuthi aqhamuka emoyeni or mhlawumbe it was possibly injected somewhere and then somehow we have ama-diseases that we don't understand. So with the cancer, I honestly believe ukuthi it's based on ukudla. Yes, hereditary, but it's mostly ukudla and how a person lives. Yes, it also could DNA, how a certain generation possibly lived, but ukudla has a major impact because our ancestors they never abakazi magula for the longest time because they had certain foods that they ate. They ate ukudla that came from umhlaba. They ate ukudla that was just naturally from earth.
And they never had these organic meeting?
Inorganic.
Yes, I'm inorganic or inorganic fertilizers and everything like that.
Yes.
They never had that. They use the cow shit, the cow shit. Yeah, but they it's shit.
Hey, cow dung, you guys.
Cow dung. Yeah, the cow's dangy and whatnot, or all those natural things that we use. Chicken, you can say chicken feces. I've discovered that can also be used as a fertilizer for your plants, which is very important. Yeah, it is really important to eat your greens more than your whatever else that you can eat. But in the nyama, they used to eat inyama back in the days. Back in the days,
but not every day.
But not every day.
Yes, it was a specific
and
something.
Also, back in the days, our animals never got injections. That's number one.
Yeah, there's a lot of
so there's
things.
just a lot of things that are in question right now, and we can't really have answers. But eat your greens, eat your veggies, check your diet. Since inorganic and organic, organic plants and inorganic plants. I would rather say stick to organic, because organic, I believe it's something that you actually grow in the soil and then you eat. You go there, get it, we wash it, and then eat.
Eating healthy is very expensive. Actually, it's not. Uyakwazi ukuzitshalela abantu abaningi vele abathanda ukutshala futhi abakwazi. But you can also repurpose mhlambe ama-mint. Uyakwazi ukuthi mangabe uthenga uMint wakho ulontuze ihlahlanyana or like a leaf nyana, replant the same thing. Angithi mina kimi khona ilontuza ninde u-anyanisi, spring onion. You can literally repurpose that spring onion. Qale phansi futhi ufake phakathi emanzini ikhule usunanyanisi, rather than going to buy it from Kachekazi, sorry to name it dollar, but like rather than buying from retail stores and then GMOs. Those GMOs already have some certain disease on us. So much it's hereditary because really a certain ancestor or a certain level of your ancestors but decided to exercise. They decided to be lazy. I would call it lazy, but because everything is just around us, everything is efficient, everything is a motor. Our ancestors used to walk, we used to do a lot of work, but I'm sorry to bring this in, but the capitalism is mostly from 9 to 5. We don't have the time. It's from scratch, and that has really it's mostly as a country, as people, as the human race. So I highly believe the core of this, or the core of ama diseases amaningi, it's a dis-ease to your body. So umzimba wakho mangabe usuqala ucommunicate now, uyasho ukuthi angisafuni mfethu ukudla into kanjeni. Feed me something very organic, feed me something eyomhlaba ngoba vele phela ngithi wenziwe ngamanzi. Your body is made out of water. That is just the basics of it. Yo, that's kuningi, and I could go on the whole day, but like she said, eat your greens. Just make sure we are raising some udla ama greens akho. Inyama sayithanda shame. But try to reduce inyama yakho. Try to reduce the alcohol. Try to reduce all of these nice things, but make sure that you have your greens. Make sure that you drink your teas. You drink your water, obviously. You exercise here and there. Please water healthy, guys. It's not that hard. Spinach in Alanyang is like 7 rand. Kabish nakhona. Yeah,
But also,
ungalitona futhi. This is
yeah, to actually add on what she said. There's also, you must also check ukuthi whatever veg or whatever product you buy, is it its season. Should it not be its season, you should question how come did it actually go on and be there, like how was it produced. So that's where you must know what is this is an inorganic plant, right? And for a person who's watching at home and who doesn't know what to spot in a body that tells what's in they are diagnosed with breast cancer, you can check your boobs every morning.
Feel your breast down until and all over until you cover the whole breast, and then you can touch the nipple areolar area. What you're looking for is to see if there are any masses that you can feel, any dimples or anything abnormal, anything that doesn't feel like the rest of your body. If you find any abnormality, you can always go to your doctor. Remember, you can always mark any part where you feel any pain or any masses, anything that feels different than your breast. And then you feel the back of your arm, the axilla area, and then you feel your breast in a circular motion from low to medium pressure, and then you repeat on the other side.
Right? So to everybody who's watching out there, we are very happy that you watched and you stayed with us, and I hope that you will add. This is me finally saying goodbye to everybody. But this is I would like everybody to take control of their own bodies. If your body reacts in a certain way when you're eating something, try and stop eating that. Yes, you were gonna say?
I was gonna add on Wuti, to find out more information about breast cancer. You can possibly check Google research, go to the library. There's a certain organization that deals with cancer. It's called Cancer, CANSA. It's a foundation. I think it's called in Pretoria. I will link I will add the link to our YouTube channel, but also the numbers as well. I think there's 3 numbers. WhatsApp is 2. Masakona, I think it's toll free, I'm not sure, but it's a toll free number. Yes, I want to wrap it up. Please take care of yourselves. Need gym if you must. Not necessarily gym, but like make sure you move. That's a walk or swim. A walk a day is you can go so make sure you get up and go somewhere morning langa, at least 5 minutes a day. That really helps get the energy from the sun. Take a walk, because cancer is real. Cancer is something else, and what I saw go in myself. That's why I decided to get up, at least jog once a day or once a week, but do some sort of exercise, because anything could happen. So now me personally, I try to reduce eating this time level because I'm trying to take care of myself. So that's me. It's T. Thank you.
Thank you very much, T, for the information. Like you heard, we're gonna leave a link, cell phone number at the end of the video. And yes, there are also other channels that you can actually go to. Your YouTube, your TikTok, you can actually search anything these days. So try and make more research so that you know if you are still fit enough, if you are still healthy as you think you are. Thank you. This is K.I.P. Bye.